Hello, dear student friends. I welcome you all to this video on clinical social case in community medicine practical examination. So this is the season of examinations going on. So in the practical of community medicine, it is for 30 marks. So 10 marks are given for clinical social case, 10 marks for the spotting and 10 marks for the biostatistical and epidemiological exercise. So in this video, we will discuss about the clinical social case, which is actually the 1/3 of the practical exam. So in the practical exam, they allot you different types of cases in which you have to go for taking the history. So history is taken to note down all the points which are relevant to the case, to the patient, to the family, and sometimes to the community. So let us see the steps involved in recording clinical social case. So first you need to record socio-demographic data. So name, age, gender, address particularly, it should be complete address with mobile number and email ID. From this, you come to know that the patient is from urban or rural area. And to communicate to the patient, we need complete address. Then we should record the education, income, occupation. So these are all given in the textbook of community medicine. So likewise, you have to record. You should not record in a haphazard manner. So particular terminologies are given for the occupations like unemployed, unskilled, semi-skilled, skilled. So all these definitions are given in the textbook. You need to refer them and categorize them according to their occupation. Now we start the case after general data, that whether the patient is from OPD or whether the patient is admitted case through casualty or OPD, what are the chief complaints. So you have to write down chief complaints by giving numbering in a chronological order. Means the complaint which came first should be written first, and the complaint which came second, third, like that. You have to enumerate the chief complaints, and you have to write down the duration also in front of the complaint. Now next part is the history of present illness. So whenever we describe history of present illness, we follow these three headings: onset, duration, and progress. That is ODP. So each and every complaint should be described under these three headings: onset, duration, and progress. And in the last part of the history of present illness, you should ask about the negative history, which may suggest you about a particular diagnosis. So don't miss recording negative history in history of present illness. Then we go to the past history, that will be about the history of similar illness in the past or any other major disease patient had in the past. Then personal history. I have seen many students when they describe personal history, they go to the bladder and bowel. Bladder and bowel is not related to community medicine. Please don't comment on that and don't bore the examiner. You should focus on addictions. So you should make a table like this and write down the names of the addictions patient is having. If there are no addictions, write down no addictions. If there are addictions, write down the name of the addiction, and you have to describe the duration, frequency, and quantity of that addiction, because these are the risk factors for most of the non-communicable diseases, and the patient is likely to develop this disease because of the exposure in the future life. So you need to advise the patient or educate the patient about the addictions. Then comes the family history. Family history actually is a little bit different in community medicine. You need to first define what is the type of the family, whether it is a nuclear or joint family, and you have to describe or write down the family composition. And you have to write down the names of all family members starting from the head of the family. So eldest male member of the family will be the head of the family. If the male had died, then the eldest female in the family will be the head of the family. So write down the name of the family member, age, gender, occupation, their health status, if they are suffering from any disease, they are known case of any disease, that should be written. And if there are children below 5 years, then you need to record the immunization status. So like this, you have to note down in detail about the family history. Now next is treatment history. If the patient is a known case, means already diagnosed case, and he has come to our hospital for management or for any complication, in that case, you need to record the treatment history. Where first you need to find out when patient was diagnosed, where he was diagnosed, and how he was diagnosed, and what treatment is prescribed, whether the patient is taking treatment or not, whether the patient is following follow-up or not, whether patient is doing investigations regularly or not. These you need to record in case of treatment history. Then next is the immunization history, particularly if the child is below 5 years of age. You have to start the history of immunization from the birth till the age of the child. So if the patient has received, the baby has received all the doses according to his age, then the child is fully immunized. If the child has missed 1 or 2 doses, then it is partially immunized. If the child has not received any dose, it is the unimmunized child. So you need to advise to the mother depending on the immunization history. Then very important is nutritional history. First, you need to inquire about the type of diet, whether it is a mixed diet or veg diet. It is not non-veg because no one is purely non-vegetarian. So the method we use is 24-hour recall method or oral questionnaire method. So here again, you have to prepare a table where you have to divide the last 24 hours into breakfast, lunch, dinner, and any other like evening snacks and all. Write down the name of the food item, approximate quantity. So in the breakfast, there may be 2-3 items you must be taking. So you should write down 1, 2, 3. Their quantity approximate, then energy content, and at least protein content. Actually, ideally, you should know the carbohydrate content, the protein content, fat content, how much minerals and vitamins are also there. That should also be known. But even if you know energy and protein content, that will be sufficient because we need to comment on this. So what you have to do, you have to write down and then you have to make the total of energy content and the total of the protein consumption. And depending on that, you have to find out the total energy consumption and total energy requirement. So it is given in the book, depending on the physical activity and the gender, the energy requirement will be different for light activity, male and female, moderate activity, male and female, heavy activity, male and female. So you need to find out the requirement, you must know, find out the consumption, and then you have to calculate the either energy deficit or the energy excess. So depending on this, you need to advise to the patient. Then total protein consumption requirement, that is 1 gram per kg body weight in an adult. Newborn child up to 6 months, it is 2 grams per kg, and then up to puberty, it is 1.5 grams per kg body weight. So like this, you need to find out the protein deficit or excess, and you must include this in your advice. Advice should be given related to the nutrition to the person and to the family. Now, next very important is socioeconomic history. So here, particularly, you need to ask about the social history or any social factors involved in the causation of the disease. This is very important because it is a clinical social case. So in clinical case, they usually don't ask about the social history, but you need to include the social history. You need to find out is there any social factor or social cause leading to the disease. Then you need to determine the socioeconomic status of the family by applying 2 classes. One is BG Prasad scale, which is usually applied for rural population. Then it is based on the per capita income, and there are 5 classes. In case of urban population, we usually apply modified Kuppuswamy scale, which is based on income, education, and occupation. So like this, we go for determination of the socio-economic classes of the family or individual. Socio-economic class of the family, actually, we find out. So in modified Kuppuswamy scale, we have 5 classes, and they are labeled as upper middle, upper lower, and lower. So actually, there are 3 major: upper, middle, and lower, but the middle and lower is further classified into 2 groups. So there are 5 classes again. So if you are applying a modified Kuppuswamy scale, you should comment in terms of upper middle, upper lower, and lower class of socio-economy. Next is environmental history, which is very, very important. So you need to start with the housing, whether the house is kacha or pakka, what is the location of the house, then ventilation in the house, that how many doors and windows are there, what is the size of the windows, whether it is the area of windows and doors is the 25% of the floor area or not, then whether what is the source of the light, whether it is a well lighted house or not. Then you need to inquire about the kitchen, whether kitchen, what is the source of the fuel, whether they are using the LPG or whether they are using the wood chula. So all this you need to inquire from the family. Then about the storage of the food items in the kitchen for the perishable and non-perishable food items. Then around the house, whether there is any vegetation or not, that you need to find out. Then you need to find out about the drainage, whether it is an open drainage or closed drainage. Then waste disposal, solid waste disposal particularly, how the waste is collected. So particularly solid waste, how it is collected, where it is stored, and how it is disposed of. And nowadays they are asking, corporation people are asking about separation of the dry waste and the wet waste. So that should be segregated, whether they are following the color code or not, that you need to ask. Then about the disposal of the liquid waste in the form of the excreta, whether they are using sanitary latrine or whether they go for open defecation, that you need to ask. Then in the house, whether they are having pets or not, whether there are cattle or animals, and whether that shade is available or not, that also you need to ask. Regarding the water, what is the source of the water, how they are storing the water, and what kind of treatment is given to the water, that at least you should ask. Now, very important in environmental history is the social environment. How is the environment in the family, whether there are quarrels, whether they are the family is stressed. This all you need to record in case of environmental history. So these are all the various histories which we record in the history section. Now, next section is the examination, which is divided into two parts. One is general examination, and second one is the systemic examination. So, in general examination, particularly, record the blood pressure. Whenever you come to take a clinical social case in community medicine, please bring with you stethoscope, torch, measuring tape, and a hammer. So these are the things you should bring, and you should use them. Blood pressure apparatus is available in the ward, so that you need to use, record the blood pressure, and particularly anthropometric examination should be stressed in adults and as well as in the children. So in anthropometric examination, weight, height, waist hip ratio by calculating the waist circumference and hip circumference, then mid-arm circumference, head circumference, and sometimes the abdominal girth to know the central obesity. So these are all the important points in general examination, other than the orientation, consciousness, pulse, respiratory rate, lymphadenopathy, pallor, and all you should record in addition to this. Then we go to the systemic examination, in which you should start with cardiovascular system, then respiratory system, then for abdominal examination, particularly in case of antenatal case and postnatal case, then central nervous system. If you are getting a cataract case, then you have to do the examination of the eyes, then local examination for presence of any ulcer or diabetic foot, then you have to do the local examination. So like this, we do the complete examination in the form of general examination and systemic examination. So once we complete the history and examination, we should have some provisional diagnosis or differential diagnosis. So whatever, depending on the positive history and examination, you should write down the differential diagnosis. And after that, we need to confirm the diagnosis by doing some investigation. So you should write down the relevant diagnostic or screening test. Don't make a long list of investigation and just copy paste. It should not be like that. Whatever relevant and required investigations which are required should be written on your case paper. Then after these tests, we can come to the final diagnosis. So you should write down name of the disease or condition. Don't write the name, age, sex, and residence and complaints, and then comes the diagnosis. That should not be there. Suppose you have an ANC case, so it should be diagnosis should be antenatal case with complication or without complication. Or if you are having a PNC case, you should write down postnatal case. So like this, completely diagnosis should be written. Suppose if you are having a case of diabetes mellitus, you should write down diabetes mellitus. Or if patient is already diagnosed, you should write down known case of diabetes mellitus with some complication or without complication. Like in hypertension also, you should write down the hypertension with the grade, depending on the level of blood pressure. So your diagnosis should be complete. It should not be the summary of the case. Most of the students, they write summary, which should not be written in final diagnosis. It is the diagnosis is nothing but the presence or absence of disease. We confirm whether the disease is present or not. So once you say the disease is present, you should write down the specific name of that condition or the disease. Then once you diagnose the disease, we should not leave the case like that. I have seen many students, they just stop their history taking at the provisional diagnosis, which is incomplete history taking and case taking. So once you diagnose, you should manage the case. At least you should, because you have passed pharmacology, you should write down the relevant medication, their doses, and for how many doses they are supposed to take. Like suppose if you have diagnosed a case of pulmonary tuberculosis category 1. So what is given in the national program for category 1, you should write down the complete name of the drug, dose of the drug, and the frequency of the drug. Prescription writing is taught to you in detail in pharmacology that you need to write in the management of the case. And then you have to go for the advice given to the patient depending on the presence of disease and the social problems which you found, to the individual, to the family, and to the community. So advice is very, very important part in community medicine case, which should not be missed. Then if you are having a disease, communicable disease case, then you should try to find out what is the source of infection. Because if we remove the source of infection, the chances of prevention of the disease is very high. And you should advise some follow-up to the patient, that how frequently he is supposed to come for the next examination. Now, I have given some list of important cases which are usually or commonly kept in the examination of the community medicine. So mostly communicable diseases, they are kept in the form of tuberculosis, diarrhea, acute respiratory tract infection, malaria, typhoid fever, dengue fever, or PUO, that is pyrexia of unknown origin. So like this, these are some cases from communicable diseases which are kept. Then there are some cases from non-communicable diseases like hypertension, diabetes mellitus, obesity, cancer, cataract, or any cardiovascular disease like coronary heart disease or myocardial infarction can be kept. In MCH, they keep antenatal case, postnatal case, under 5 child, malnutrition, anemia. So these are all the different types of cases which are kept in the exam. So you have a list. So you should read about this from the textbook of community medicine, and also read about the national program if it is there for that particular disease. Suppose you are presenting a case of tuberculosis, so you should know what is the name of the program, what are the activities which are done in the program, and what are the recommendations in the program, what treatment is given in the program. So all these you should know about the national program of that particular disease, also along with the detailed study of the disease. Some students, they are over enthusiastic. If they want to score more marks, they can also refer the textbook of pediatrics, textbook of medicine, and textbook of the obstetrics and gynecology. So like this, you can have some additional reading also. You can refer the pharmacology textbook also. You can refer the pathology textbook also. So like this, you should refer, or you should do some integrated kind of teaching, so that it should help you in your examination and also in your part 2 MBBS, final MBBS examination also. So like this, you should take the history, record the clinical social case. Marks are 10. 5 marks are for the write-up on the case paper, and 5 marks are there for the viva. So you need to prepare for viva also. You need to study the disease or condition in detail, and also national health program. So this is all about the clinical social case in community medicine. I hope that you like this video. Please subscribe, like, and share. Thank you.